First at 4 today, a very big step forward in the fight against COVID-19.
Pfizer is saying early data from a large study shows its experimental vaccine is more than 90% effective in preventing the coronavirus. The announcement leading to a surge on Wall Street, the Dow Jones Industrial Average jumping 1,500 points in early trading, growing more than 4%. But it comes as the U.S. hits another grim milestone with more than 50 million infections now worldwide and cases continuing to rise at an alarming rate. For the latest on this vaccine development, let's get right to 12 News reporter Brandon Truitt. Brandon, a lot of people are curious on a timeline, of course, for all of this.
Yeah, that is the big question as we come on the air. We're here at the Department of Health because when it is time, they're going to serve a huge role in passing these vaccines out. But listen, we are not there yet. Today I spoke with a couple of doctors who are experts in infectious diseases who say so far they like what they're seeing.
The bottom line is this is really good news.
A positive outlook from a doctor known for telling it like it is. Dr. Ashish Jha is the dean of Brown University's School of Public Health.
A vaccine that might be 90 or 90+% effective, I think it certainly surpasses my expectations. I think it surpasses the expectations most of us had.
Dr. Jha says he expected a vaccine effectiveness rate around 60%, far lower than the 90% reported by Pfizer Monday. The study, sampling roughly 44,000 people from multiple countries, but these are early results.
We don't have that much data yet, but so far it doesn't look like there are any safety problems.
Dr. Karen Tashima agrees.
No, I think it's really impressive.
Dr. Tashima, with a career in the development and testing of vaccines, saying she likes what she's seeing from Pfizer, but wants to see more.
We're all looking for the data to be able to say with more confidence that this is something that we should all be receiving.
There are more hurdles to get through before these vaccines get from testing facilities to you. In the meantime, Dr. Jha saying we have work to do ourselves with what he calls a very tough couple of months ahead.
We're going to see large outbreaks, lots of infections, lots of deaths across the country. Unless we make some very substantial changes, I believe an additional 100,000 Americans are going to die between now and Inauguration Day.
This vaccine, if approved, will come in 2 doses, 2 different shots. So the question right now, who gets it first? Well, Dr. Jha says if this stays on the track that it's going, it's likely that first responders, frontline workers would receive a first dose sometime around the end of the year. After that, elderly people sometime in March, with the general public ready to roll possibly by May. Again, that's a best case scenario. And guys, there are several steps until we get to that point.
And Brandon, a grim prediction and projection there from Dr. Jha. So I want to know, how prepared is the state of Rhode Island to distribute a vaccine once it is ready?
Well, I asked Dr. Jha about that, and you might remember earlier in this pandemic when several states were really battling other states to get that PPE. Dr. Jha saying he doesn't see that being the case this time around.
We do not want states competing. Like, this is not the point. And look, we are the United States, and we want this distributed based on need and not based on who's got better political connections. That's not what we want. Second, in terms of Rhode Island, I think we're very well set up. We've got a new vaccine task force that the governor has put together that's going to help think about distribution and equitable distribution in our state.
So some really good insight there from Dr. Jha. He is very plugged in on this. I'll have much more on how Rhode Island is planning to handle this. That's all ahead of my report at 5 o'clock, guys.
Brandon, a huge story today. Our thanks to you. Pfizer, by the way, isn't alone in the multi-billion-dollar race for a vaccine. Moderna is expected to report results from its large-scale trial this month. The Massachusetts-based company could seek emergency approval as early as December. AstraZeneca, along with Johnson & Johnson, are also in phase 3 of their trials.